Good morning, this is Dr. Dwight Lundell. We're Facebook Live with Adapt Your Life, and glad to be here. My name is Dr. Dwight Lundell. I spent a good part of my adult life in a cardiac operating room doing heart surgery. I was lucky enough to be in the very first class of the medical school at the University of Arizona, and then finished general surgery residency there. When I was there was not much we could do for people with heart attacks. We had a few crude medicines, but they had this brand new operation called a coronary bypass came along. Well, it just fascinated me, number one, to take over the circulation, and number two, to be able to return someone to their family, to their work, to their life, prolong their life, and sometimes save their life. And so this captivated me, and after finishing general surgery training at the University of Arizona, I went to Yale University in Connecticut to finish cardiac surgery training. And I came back to Arizona and went to work doing coronary bypass operations. Ultimately, over the 25 years, I did over 5,000 coronary bypass operations. I did hundreds of valve operations, this nice carbon valve and tissue valves and aneurysms and lung cancer and peripheral vascular disease. Had a very, very satisfying and busy practice. I was sort of like the man with a hammer. Everything looked like a nail. Mark Twain called that the law of the instrument, that we tend to overuse our narrow skill sets and knowledge to solve every problem. At any rate, at least I was trying to make my hammer better. The heart-lung machine, a wonderful device that saved literally millions of lives over the years, has side effects. About 50 to 60% of people have temporary cognitive impairment. 2.5 to 5% of people have a stroke afterwards. Well, I mean, it was not very nice to be able to fix someone's heart and then have them disabled from a big, massive stroke. And so some of us began to ask, can we do better? Is there a way that we can improve this process? Can we do a coronary bypass without using the heart-lung machine? Well, I wasn't the first one to do it, but I was an early adopter and worked with industry, and I worked with other surgeons to help develop tools so that we could do this. And what we did is, like the foot on the sewing machine, if you've ever seen one, it stabilizes the fabric for just a second while the needle goes through. Well, what we did is stabilize that little piece of the heart where we were going to make the connection and let the rest of the heart beat, save that little spot, and we could then complete the anastomosis. And with the help of this cute little device, which we helped industry do, we could lift the end of the heart up and do the blood vessels on the backside, so we could do a complete revascularization, fix all the blockages without using the heart-lung machine. This was very satisfying to me. My partner and I did 1,000 consecutive cases without a single intraoperative stroke. So we saved 25 to 50 strokes, which is pretty gratifying. Our mortality rate was very low. People went home from the hospital 2 or 3 days quicker than usual and didn't have the temporary cognitive impairment that went along with the heart-lung machine. Now, as I say, I was the man with a hammer, and I was busy practice, doing all these surgeries every day. I didn't care really what caused heart disease. I just didn't care. If you had it and you were in trouble, I could fix it. So, to me, everything was right. But over the years, I began to be a little troubled. I noticed that in spite of all my cardiology friends preaching about cholesterol, that most of my patients had normal cholesterol levels. Even when they'd come back 10 years later sometimes for another operation, because the grafts had plugged up, they still had normal cholesterol. So it didn't quite make sense. And I began to study and learn and do the best I could to try to find out what's going on. I made the observation in the operating room, looking down at the coronary artery, that there was redness and swelling around the plaque area. Well, these are two of the cardinal signs of inflammation. So I began to wonder if inflammation was part of this. Well, people smarter than me also were wondering if that was part of it. And they did a lot of work. There's a man by the name of Russell Ross, who was a real student of vascular biology, and over the years worked very hard to prove that inflammation was the mechanism whereby plaque built up in the artery. He published this article in the New England Journal of Medicine in 1999. Sadly, he died shortly thereafter, of cancer. But he was a great student, and this article laid out in detail the biochemical and the cellular mechanisms whereby inflammation caused arteriosclerosis. Now, maybe the most prolific authors about inflammation and atherosclerosis were Peter Libby and Paul Ridker from Harvard. And they published in the lay press and they published in the scientific literature many, many articles about, once again, reiterating the biochemical and cellular mechanisms whereby plaque built up in the blood vessels and ultimately caused stroke or heart attack or limb loss. So the steps were very, very well worked out. And so this was a shift in our knowledge about coronary disease. But to me, the sad thing is that what was the question that Ridker and Libby asked? They didn't ask what's causing this inflammation. They asked what medication can we use to get rid of the inflammation or reduce it. They asked the question, is the statin medications, which we believe are going to cure heart disease, do they have an effect on inflammation? Well, Paul Ridker ended up being the co-inventor of the C-Reactive protein test. And based on the C-Reactive protein test, they did the big Jupiter study to justify treating normal cholesterol patients with statins, hoping that they could reduce their coronary disease. Well, they claim they got a positive result, and you remember the Lipitor ads, they all said reduce your heart rate by 30%, your risk of heart attack by 30%. Well, that's a statistical trick called relative risk. And relative risk is just another way to lie. So the real risk is very, very slightly reduced, even under the best of circumstances. And once again, in spite of all of the authorities assuring us that coronary disease was going to be cured with the advent of statin treatments, this study published in 2009 demonstrates that of 136,000 patients admitted to hospital with coronary disease, heart attack, had normal cholesterol, 70% of them. So the theory that cholesterol causes heart disease and is maybe correct only 30% of the time doesn't make very much sense to me. So, but once again, they said, well, maybe we need lower levels. Maybe we need to get your cholesterol even lower. So there was a mantra that went around in the cardiology community, lower is better. Of course, that was a marketing ploy by Pfizer and the other people that make statins. The National Cholesterol Education Program is a big program, and it's got a staff of prominent cardiologists who make recommendations about the levels at which we should treat cholesterol levels, called Adult Treatment Panel, or ATP. So this study in 2009, ATP3 was out at that point in time and said we should treat cholesterol at LDL cholesterol at 130. Well, obviously, that didn't stop all these people from having heart attacks. So the adult treatment panel said, well, we're going to go to a risk calculator with age and blood pressure and weight and cholesterol levels and hypertension, a few things, and we'll use this risk calculator. If you have a chance of dying X amount in the next 10 years, then you should go on a statin. Well, that made it so another 30 or 40 million people were eligible, as did treating people with elevated C-reactive protein levels. But the interesting thing is that cholesterol was labeled as a surrogate marker for heart disease. because it's approved by the FDA in the United States for treating cholesterol. Specifically, in the product insert, it's not approved for treating heart disease. But nobody pays attention to that. We just made the leap that if you got cholesterol down, you were not going to have a heart attack, which turns out not to be true. Even the new drugs, the PCSK9s and the ones that raised the HDL, they lowered LDL levels dramatically. PCSK9s can get your LDL to 30, and yet in the most recent publications, event rates, heart attacks or death, are unchanged. Same thing for the drugs that raised HDL and lowered LDL. Most of the companies have abandoned those drugs because they didn't work and had certain side effects. So it's just your doctor, sincere as they may be, will insist that you need to get your statin drug if your cholesterol level is elevated. Well, there are a few researchers, and getting to be more and more, who are questioning this. Now, it took 30 years of statin treatments before we admitted that they actually cause diabetes in a certain number of people. 1 in 50 people on a statin will get new onset type 2 diabetes. A cardiologist by the name of Lord Gurel in France published this study, which is extensive, in where he examines every single statin study ever published. He divided them into 2 categories, those before 06 and those after 06, because the reporting requirements changed to be more strict after 2006. Well, guess what? The pre-06 papers show benefits from statin. The post-06 papers don't. They don't show any benefit from statin treatments, and they demonstrate that we've been underreporting and underdiscussing all the complications all this time. So the British Medical Journal brought out this article that if you're being treated either for primary prevention or secondary prevention, the amount of time you can expect to be added to your life is about 4 days. That's under a favorable interpretation of the statin literature. So, doesn't make much sense. And I've never been a believer in cholesterol. I don't think it's the marker. Based on the literature, I'm more and more convinced every day that it is not the cause of heart disease. It is a marker for something. It's a marker for eating too much carbohydrate, because the carbohydrate gets turned into triglycerides, which then are carried by VLDL. Once they deliver those triglycerides, that becomes LDL. So if you want to raise your LDL, eat lots of carbohydrates. If you want to lower your LDL, eat lots of saturated fat and lower your carbohydrates. Simple as that. Dave Feldman on the cholesterol code has done some interesting experiments on himself and proved that his high-fat diet took his cholesterol LDL to very low levels. Interestingly, go look at his experiments on the cholesterol code. They're interesting. On the other hand, I think cholesterol is not that important, and something else is important, and that's sugar. That's carbohydrate. If you look at the rate of diabetes and obesity, they correlate with the onset of the 1977 dietary guidelines, when we were advised that we should eliminate all saturated fat and eat 60 to 70% of our diet as carbohydrates with healthy whole grains, etc., etc. Well, the correlation between diabetes and obesity epidemics is absolutely right on the money. We have reduced our eating of saturated fats. We have not eliminated heart disease. And saturated fat, by the way, is guilty only because it raises LDL cholesterol. And if LDL cholesterol is not the perpetrator of heart disease, then elimination of saturated fats makes no sense, in spite of the recent American Heart Association presidential advisory. More and more studies and a re-examination of the old studies of replacing saturated fat with vegetable oils shows that the vegetable oils actually make us worse than eating saturated fat. So we'll put that to bed. So what's Where are we going from here? What is the real cause of heart disease? If Ross and the others are correct that it's inflammation, and that inflammation follows injury, then the real question, and the one I asked, was what is causing the inflammation? I asked that question near the end of my surgical career, and I agitated with the hospital to try to change things. Let's do some prevention. Let's not wait till these people are at death's door before we take care of them with a dramatic and expensive treatment. They didn't like that. They thought I was a big threat to the revenue stream, even though I was producing most of it. And so after a little while of beating my head against the wall, I said, I'm going to go prove that I can reduce the so-called risk factors of heart disease by changing diet. And I closed my successful surgical practice and opened a clinic that was focused on weight loss and focused on low carbohydrate nutrition. Now, weight loss was sort of a side effect. To my delight, we could reduce all the diabetic medicines. Everybody came off their insulin relatively quickly. Most of them came off their oral medications very quickly. The lipid panels improved, if that even is a risk factor for heart disease, but they improved, they got better. So this was pretty dramatic proof to me that I was correct, and that some others were correct, that low carbohydrate nutrition was the way to prevent heart disease and lots of other degenerative conditions. Well, I decided that I couldn't make a big impact one patient at a time. Yes, those individual patients had a great impact, and that was wonderful. So I closed that clinic. I wrote a book, an online course. I published some articles that were picked up by some websites in the UK. Ended up going around the world. It's been repeated more than 2 million times on Facebook. The surgeon talks about how to cure heart disease. So that's been gratifying, but I made a lot of noise. And so some 4 years after I retired, and 3 years after I closed the clinic, the Arizona Medical Board had a little hearing and took away my medical license. Well, in some ways I didn't care. I wasn't using it. If I'm not driving a car, I don't need a driver's license, so I didn't care. But on another side of me, it hurt a lot. It's a blemish on an otherwise unblemished career of mainstream medicine. Well, is it a blemish? Or is it a badge of honor because I spoke out against what I felt was wrong? I even proved that mainstream medicine was wrong, and yet was punished for that. So is it a blemish or is it a badge of honor? I'll let you be the judge of that. Nevertheless, it's sugar. And the most prominent example of people with high blood sugars is what? It's diabetics. People with type 2 diabetics, of which there is an epidemic and which will overwhelm the healthcare systems in every modern country in the world if we don't begin to do something about it. It's sugar. So what happens to diabetics over time? They go blind, they lose their kidneys, we amputate their legs, they have severe neuropathies, and they have kidney failure, and they die of heart disease. It's the same old heart disease that everybody gets, and yet they had normal cholesterols. So what is it? Well, there's a professor by the name of Michael Brownlee in New York who at the age of 8 was diagnosed with type 1 diabetes. And at that time, the type 1 diabetic could expect to live in their mid-20s, and that was about it. They would have died much sooner had Banting not invented insulin in 1922. Nevertheless, so he began to study it. He became an MD, and he's done very well. He's in his mid-60s and still teaching, I believe, at Cornell. At any rate, his interest in this obviously is more than scientific. It's personal because it's his life. So he published an article detailing the mechanisms by which sugar damages. And so his question was, what is the unique thing about these particular cells that they're so damaged by high blood sugar? And all of those cells are endothelial cells. Now, the eye and the kidney are unique in that there's no other way for blood to get there. And they're very specialized, and so they were very vulnerable. But the rest of the endothelium, the peripheral vascular disease, the heart disease, the stroke, those are just the same as everybody. So his question was, what is it about this endothelial cell that causes it to be so injured? And injury causes inflammation, and inflammation is the mechanism of heart disease. But nobody had asked, what's causing it? And he asked what's causing it, and he wanted to know exactly why sugar was causing it. There are 4 pathways. I won't bore you with all of them, but they boil down to the 2 most important. One is glycation, which occurs not only in the endothelial cell, but it occurs all over the body and causes damage of its own. Now, glycation is when a protein and a protein and a sugar or a fat get combined. It's how we make fudge. We take our cream and our sugar and we mix them together with some flavoring and cook it, and it becomes fudge. But we can't put it back in the refrigerator and have it turned back to sugar and cream. It's an irreversible reaction that causes cataracts and bone loss and arthritis, a whole lot of other things. So it occurs all over the body, and it's important. And in fact, that's what we measure. Hemoglobin A1C is glycated hemoglobin, indicating our average blood sugar over the last 90 days or so. At any rate, the most important pathway, and the one he called the unifying pathway, is the fact that the glucose gets presented to the endothelial cell inside of the endothelial cell because it cannot say no. Other cells have what's called GLUT4, insulin receptors. The insulin activates those. They begin to actively pump sugar inside the cell. All of those cells with GLUT 1, 2, 3, or 4 receptors, once they have enough sugar on the inside, they turn that receptor off. They can say no. We're full. We got plenty of sugar. We don't want any more. Because if you send it in here, it's going to mess things up. But the endothelial cell does not have that privilege. Its intracellular content is very close to blood sugar content. And what happens when all that all that glucose energy gets presented to the mitochondrion, it overloads it, it produces a whole bunch of extra free radicals, which then cause damage to the cell, which then trigger the inflammatory cascade, which then cause macrophages to consume the oxidized and glycated LDL and begin to cause a plaque in the subendothelial space. So it's the fact that the energy overload to the endothelial cell, once again, which has no defense, that causes it. Now, 1 cupcake, 1 can of soda doesn't kill us. It does damage to those cells. They get well. If I sunburn myself here in the Arizona sun a couple of times this summer, I'll be fine. If I sunburn myself 3 times a day, 365 days a year for 20 years, I'm not going to have any skin. And this is what we do with a standard American high carbohydrate diet. We sunburn the inside of our blood vessels many, many, many times a day. They can't recover. The inflammatory cascade never stops. The macrophages are always activated. They're always eating the glycated LDL. They're always eating the oxidized LDL, which occur as a consequence of the overloaded sugar in our bloodstream. So really, that's the basic mechanism of heart disease. Not cholesterol, not salt, sugar. Sugar. The most powerful health tool is not a treadmill, it's not a weight machine, it's a glucometer. If you want to stay healthy, have dinner, check your blood sugar an hour later. If it's more than 130, 120, don't eat what you ate. You can do that with any meal. The path to ill health is paved on hyperglycemia. One man asked me the other day if I said, don't eat your oatmeal for breakfast. He said, are you anti-grain? Well, not necessarily. I understand Bill Davis's ideas about grain, but I'm not anti-grain. I'm anti-hyperglycemia, which then leads chronic hyperglycemia leads to insulin resistance because insulin levels are high. And once again, the cells, they just say no. That's insulin resistance when the cells are full and they don't want any more. So don't get confused about insulin resistance as a separate disease. It's a condition caused by eating too many carbohydrates. So once again, if you want to be healthy, control that blood sugar, stop eating the standard American diet, get yourself on a reduced low carbohydrate diet with extra healthy saturated fat and a moderate amount of protein. That's the key to health. Low carbohydrate nutrition is the key to health. So thank you very much.